My job is to try and scrutinise anything that comes out of NHS England or Department of Health and Social Care to see what the implications are from our college and say what we think fellows and members would want us to say about this.
In this episode, Adrian and Sam take us through the massive scope of work in the college's quality and policy teams.
My background's in quality improvement and patient safety. I've worked with some other colleges in this area and also for the commissioners who commission quality improvement programmes nationally.
College seems to have a knack of hiring people who are very bright, very committed and incredibly efficient.
We've got quite a variety of backgrounds on top of that. So one of our team members, the deputy manager, he used to work in a trust. So he's got a really good understanding of how emergency departments work on the ground and how trusts function.
Within 1 year of becoming a consultant, I was asked to set up the Guideline Committee, which became best practice, which is a unique college committee because it offers advice for where there is no evidence.
And that's something that is very member-led. Often a member or fellow will get in touch with us asking if we have advice about a certain area. We convene an expert panel and they review what evidence there is, if there is any evidence out there. And they then put together that best practice guidance. One thing that I'm really proud of at the moment is evolving our clinical audit programme into a quality improvement programme nationally. Emergency medicine is one of the first specialties to have really tried this. It's more about empowering clinicians on the floor to review their own practice in a really fast and timely way.
You'll have also seen things like the safety alerts. I don't know what you do with your safety alerts. In my department, I reckon the best place for anyone to look at those is on the back of the loo door. So we work with NHS England and they let us trawl their national reporting system and we find out things that need alerts.
We're very clinically led. I'm delighted to be very clinically led in this role. We've got a good range between consultants, trainees, ACPs, nursing staff. At any one time, there's several hundred clinicians feeding into the programme of work in the quality team. On the other side of things, we're also looking to support remote and rural emergency departments a lot more strongly than the college has in the past. That was something that came out of the last Members and Fellows survey that we did to really support those smaller departments on the workforce side of things.
We're only credible as college officers if we are actually doing the job and we understand what it's like when we make a recommendation or we come out with some policy statement. We've got to be aware of what that's going to feel like to our colleagues. One of the things that's nice about the college is you're dealing with people who are really motivated and enthusiastic. And it offers people the chance to develop themselves either around training and education, whether clinically or managerially. And of course, there's also the research aspects. So there is a huge opportunity to develop yourself by coming to the college.
I really love the variety and I love working with all of our members and fellows. I think as a specialty, it's probably the best specialty out there.
Good answer. The Quality and Emergency Care Cluster regularly has new working groups that need your input. Keep an eye out for adverts in emails and on social media.